Question 1. Which of the following findings would the nurse identify as an early sign of lithium toxicity? A. Seizures. B. Fine hand tremors. C. Oliguria. D. Tachycardia. B. Fine hand tremors. Question 2. A patient on IV heparin develops bleeding and petechia. The nurse anticipates the provider to order which of the following antidotes? A. Vitamin K. B. Flumazenil. C. Protamine sulfate. D. Naloxone. C. Protamine sulfate. Question 3. A patient taking lisinopril should immediately report which adverse effect? A. Dry cough. B. Orthostatic hypotension. C. Metallic taste. D. Swelling of lips and tongue. D. Swelling of lips and tongue. Question 4. A client receiving IV theophylline develops which signs of toxicity? A. Tachycardia and seizures. B. Bradycardia and constipation. C. Respiratory depression and pinpoint pupils. D. Hypertension and drowsiness. A. Tachycardia and seizures. Question 5. Which is an expected effect of atropine? A. Constricted pupils. B. Decreased heart rate. C. Diarrhea. D. Urinary retention and dry mouth. D. Urinary retention and dry mouth. Question 6. A client is prescribed phenelzine. Which of the following foods should the nurse instruct the client to avoid to prevent a hypertensive crisis? A. Green leafy vegetables. B. Milk and yogurt. C. Aged cheese, cured meats, wine. D. Whole wheat bread. C. Aged cheese, cured meats, wine. Question 7. A client taking sertraline is prescribed linezolid. Which finding is most concerning? A. Dry mouth. B. Serotonin syndrome. C. Mild headache. D. Increased appetite. B. Serotonin syndrome. Question 8. A client receiving morphine has a respiratory rate of 7 per minute and is difficult to arouse. Which medication should the nurse prepare? A. Flumazenil. B. Naloxone. C. Protamine. D. Vitamin K. B. Naloxone. Question 9. Which medication should the nurse question for a client with a history of severe asthma? A. Propranolol. B. Amlodipine. C. Losartan. D. Hydrochlorothiazide. A. Propranolol. Question 10. Which finding in a client receiving vancomycin requires immediate attention? A. Mild nausea. B. Redness and flushing during infusion. C. Increased appetite. D. Constipation. B. Redness and flushing during infusion.